Hello, my name is Katie, and today we are going to do a neuro assessment. Can you tell me your name?
Marla Coyne,
And can you tell me today's date?
November 10th, 2019.
Okay, and can you tell me where we're at and why we're here today?
We're at the clinic for a neuro assessment.
Okay, and are you in any pain today?
No.
Okay, so the patient's vital signs were blood pressure was 126/72, her pulse was 74, her temperature was 98.7, her respirations were 10, and her O2 was 99 on room air. She denies any pain at this time. Her general appearance is appropriate. She is well groomed. Her posture is appropriate. She is not stooped or slouching. She is able to sit upright in a chair without any difficulty. Her gait that I assessed while she walked in was appropriate. She did not have any stooped posture or shuffling gait. Her speech is appropriate. She is not slurring her words. She doesn't have any difficulty speaking. So her Glasgow coma scale is going to be a 15. She has her eyes open spontaneously. She is orientated and she is able to follow commands. I'm also going to have you remember a word for me, and that word is going to be school. And can you tell me what year you graduated?
1983.
Okay. And then I'm also going to check your pupil response. By doing that, I'm going to shine a light into your eyes while you look straight forward. Okay. And then I'm also going to have you look over my shoulder and then back at me, over my shoulder and back at me. And I'm going to have you follow my pen without moving your head. Okay. Patient is able to track and accommodate appropriately. The next thing we're going to do is I'm going to hold my finger up and I want you to touch my finger and then touch your nose and touch my finger and touch your nose. Okay. And then I'm going to check your hearing. So I'm going to cover one ear and I'm going to whisper a word and I want you to tell me what that word is.
Apples.
Same on the other side.
Baseball.
Okay. And then you can also do this with a tuning fork by striking the tuning fork and putting it on the top of their forehead. They should be able to hear that noise on both sides equally. And then you can also do the rinse test, which is where you strike the tuning fork and put it behind each ear on the mastoid bone, and they should be able to tell you when they're no longer able to hear that noise. And then I'm going to have you smile for me, frown, puff out your cheeks, stick out your tongue. Okay? All of those that she just demonstrated were symmetrical. And then I'm going to have you close your eyes. And I have a Q-tip, and one side is soft and one side is sharp, and I want you to tell me which side I'm using.
Soft. Sharp. Soft. Sharp.
Okay, and I'm also going to do that on your extremities. First, we're going to do your arms.
Sharp. Soft. Soft. Sharp.
Okay, and I'm going to do that on your lower extremities as well.
Soft. Sharp. Soft. Sharp.
Okay. Patient is able to recognize sensation appropriately on all extremities and on her face. So the next thing we're going to do is I'm going to have you hold out your hands or your arms straight out. I'm going to push down. I don't want you to let me. And then I'm going to push up. I don't want you to let me. And then you can relax. And then I'm going to Pull out on your legs, I don't want you to let me. And I'm going to push back on your legs, I don't want you to let me. I'm going to do the same on your feet. I'm going to push up, and I don't want you to let me. And I'm going to push down, and I don't want you to let me. Okay? All of the patients, the strength in her upper and lower extremities are appropriate. They're all equal and strong. And the next thing we're going to do is I'm going to have you stand up. And I'm going to have you put your arms straight out in front with your palms up. And I want you to close your eyes. So what we're doing now is the Romberg's test, which is where you have your patient stand up, arms out in front of them, palms up, close their eyes, and you're assessing for their balance. You're assessing for them to, you can open your eyes and sit down. You're assessing for any swaying, and they're able to keep their balance. The next thing we're going to do is check your reflexes. So the first thing, I'm going to have you relax your legs, and this is going to be the deep tendon. Okay. And your arms. And all of her deep tendon reflexes were appropriate. The next thing I'm going to do is I'm going to check your Babinski reflex, which is where you go up their foot and around the ball. And hers is negative, which is good. That is appropriate for an adult. And we'll do the other side too. And it's negative as well. So that's appropriate for an adult. That her Babinski is negative. And the next thing we're going to do is check your gag reflex. So I'm just going to have you open your mouth. Okay. She has a positive gag reflex. And the next thing I'm going to have you do is I want you to shrug your shoulders. Okay. And she's able to do that with any difficulty, which is also checking the cranial nerve 11. And then can you tell me that word I wanted you to remember?
School.
Okay. So that's going to conclude our neuro assessment.